Hi class, in today's video we're going to be doing the skill of removing and applying dry dressings. For this we have our supplies right here, we have our patient at a comfortable height, and we can go ahead and get started. So the first thing we always do obviously is we'll knock on the patient's door, we will introduce ourselves, do our ADA and our general survey and everything of that sort. We will provide privacy and wash our hands, and then we will verify the client identification like we always do for all our skills. Next, we are going to provide the client education that we are going to be doing his wound care, and then we can go ahead and start our procedure. First thing we always do when we do with wounds, we will assess our patient for pain. So I'll ask my patient on a 0 to 10 scale how much pain they're in, and then as long as it's not a 0, we will probably administer some pain medication because the procedure we're going to be doing is a little bit painful. So we will administer some pain medication before, let it kick in, and then we can actually go ahead and start removing our dressing. So the first step we need to do is gather our supplies, which I've already done over here. For this wound specifically, make sure you read your order and see what you need, but this is a dry dressing. So I have my dressing, I have some tape already pre-done over here. I have some normal saline to soften up the old wound dressing. I have some tape measuring to measure our wound. And then I have some scissors in case I need to cut anything, and then some gloves. So the first thing I'm going to do is adjust the bed to a comfortable height, which I've already done. And then I am going to assist the client to a comfortable position, which he is in already. Then I am going to make sure I have a blanket to cover the patient up. We don't want to expose too much skin while we're doing this. And then the next step is to apply clean gloves. Remember, I've already washed my hands. Now this is not a sterile technique, okay? So you don't have to do sterile gloves, you just have to do clean gloves. So now we will go ahead and let Mr. Jones know we're gonna be doing his wound, and then I will slowly uncover him, making sure not to expose too much skin. His wound is on his abdomen or in his peri area, so I'm going to take this up, and then I will cover this up. So you guys can see right here that the previous nurse has signed and dated her wound. So now I know when's the last time it's been changed, and we will be doing the same thing. Now we will go ahead and start loosening our tape or adhesive edges, so we have tape in this situation. You got to be very careful here because especially in the geriatric population, their skin is very fragile. So if you feel like this tape is going to hurt the skin, we need to be very careful. And in those moments, we usually use something like some normal saline or sterile water, and it'll be a little bit more, we could have a better system to use it, but you would just pour a little bit on there and it would soften it up and it would easily come off. So we would lift a corner of the dressing away from the skin with a dominant hand while gently pushing the skin away from the dressing with a non-dominant hand. So this is my dominant, this is my non-dominant. I'm gonna take my hand, take the skin, push it away from where I'm pulling the tape, and I'm gonna slowly just pull this off. And now I notice that this piece needs to come off first, so I'll take this piece first. And sometimes in these situations, scissors can help you out. I have a easy wound, but sometimes you always need scissors just to cut the wound to make it easier on the patient. So now the tape's gonna be going this way, so I'll take my hand and I'll use my dominant hand to pull the skin away. Nice and easy, nice and easy. If you feel like it's sticking to the patient or they're in pain, go ahead and use that normal saline. But in this situation, the patient is fine. Nice and easy. And that should cover the first one. Now we'll go on to the next piece of tape because they're covered. Now we'll go to the next piece. So remember, non-dominant hand, pulling away. And make sure you don't accidentally touch the wound, just like I did. We can go ahead and discard this. We will make sure we have our waste right next door. Okay, now we have removed the wound, the dressing, I apologize. Now we can go ahead and start assessing our wound. So we have a wound right here and a wound right here. So the first thing we're gonna do is just inspect. We're looking at the incision site. We're looking for any signs of infection, any redness, any warmth. There's no odor to the wound. There's no drainage. And then we can start measuring the wound now. So if you see here, we have our measuring tape, and this will be in inches. So we'll go ahead and take our measuring tape and start from 0. And we'll start at the edge of the wound and we'll go over here. So if you can see, that starts at 3, or ends at 3, I apologize. So that would be 3 inches. This one right here would be about 1.5. And I would document that appropriately. Alrighty, now that we've noted the presence, we can assess the wound. Alright, so now that we've measured the wound, now I'm just gonna go ahead and note how many sutures are in here. So we got 1, 2, 3, 4, 5, 6. In case these fall out or anything happens, we need to keep monitoring how much are in there. So now I have removed my soil gloves. I'm going to perform hand hygiene. Pause it. Alright guys, so now that we have the wound exposed, before we cover it up, we're just gonna go ahead and clean it a little bit. So you would take a little 4x4 gauze. You would take some sterile water or whatever medicine that the doctor has prescribed for the wound. Just go ahead and pour it on there. And then when you are cleaning a wound, this is very important, okay? You start from the wound and you clean outwards. You don't want to clean inwards because you're taking all the bacteria that's on the skin and you're pushing it into the open wound. So we're gonna take sterile water. You would do one side at a time. So I would take here, clean out, and then I will not reuse that side. So if you have a big wound or a big gauze, you can just go ahead and use the other side, use the other side, and use the other side and go outwards. Get another gauze and do the same thing until the wound is completely clean. Okay, now that we have the wound clean, we have let it dry completely. If there was any medicine to apply, we would have applied it by now. And now we can go ahead and start placing our new dressing. So we're gonna place a layer of sterile gauze, which I have right here, over the wound as prescribed by the provider. We gotta make sure that it extends at least 1 inch past the wound edges. And this dressing can be applied with forceps if desired, but it's a lot easier with your hands. We are going to apply either a surgical or abdominal pad over the gauze needed, and then we'll apply tape. Okay, so we have our new dressing that we're going to be applying. So make sure you guys aren't touching the middle of it because we will start infecting the gauze and it would go over the patient's wound and it could cause an infection. So just touch the edges. We would place the edge of the gauze away from the wound, and we will make sure that it covers it at least by 1 inch. And now we will need an abdominal pad. An abdominal pad just looks like this, and it will go over the patient's wound. That's just to soak up any extra drainage. And now we can go ahead and use our tape to tape it off. And once we have all 4 corners taped, making sure that it is secure, we will go ahead and date and time our wound dressing. Normally you would want a Sharpie, that would be a lot easier, so I'm just gonna go ahead and put today's date of 9/3. And it might not be legible, but you guys know what I'm putting, and then I'm just putting my initials. And then I can go ahead and remove my gloves, perform hand hygiene, and then just make sure that the patient is in a comfortable position with their call light and water in place, and then we should be good to go once I cover them up. And that covers our skills, you guys.